Hello, this is Brett here at Progressive Mobility, Physio, and Performance on Boiling Springs Road in Spartanburg, South Carolina. So, today we're going to be talking about lumbopelvic stabilization and its importance to human movement in all three planes of motion and things that we can do to start re-educating that pattern in our body. So this is the way that we learned how to breathe and stabilize when we were children and when we were babies, and as we went through that developmental kinesiology path up towards becoming an adolescent and then into adulthood, we have a tendency to illustrate and adopt some different breathing techniques, and sometimes those can be suboptimal for performance and everyday life. So we're going to be talking about intra-abdominal pressurization and how that plays into proper stabilization of the trunk and the lumbopelvic canister, or the space between the pelvis and the rib cage, the importance of the diaphragm and how that can lead to shoulder pain, back pain, knee pain, foot pain, hip pain, lots of different musculoskeletal dysfunctions that we can experience in the body. So if we take a look at these two examples here, if we think of the rib cage as the top circle and the pelvis as the bottom circle, oftentimes we can see this if we have an increased flare or increased elevation of the rib cage, causing compression in the lumbar spine and the erector spinae muscle group, and creating an opening between the plane of the rib cage and the plane of the pelvis. Alternatively, we can also see with an anterior pelvic tilt, or if the tilt of the pelvis is slightly downward or in an anterior position, we then create the same thing, compression on the erector spinae muscle group, and then that opening of the rib cage and the pelvis. We want the rib cage and the pelvis to stay parallel to each other, because when we breathe, the diaphragm is supposed to drop down like so, and then it expands outwardly against the fascia and abdominal muscles that are acting inwardly or contracting concentrically. So we have the eccentric activity of the diaphragm and the concentric activity of the abdominal wall. And when we have the plane of the rib cage and the plane of the pelvis parallel, that creates the most optimal position for the diaphragm to create proper stabilization and 360 degrees of expansion, which works to offload the lumbar spine. So what we're going to do is we're going to lie on our back. We're going to start lifting our hips up, and we're going to do like a glute bridge position. We're going to lay each vertebrae of the spine down one at a time, so the back is nice and flat to the ground. Things you want to think about here is minimizing the rise in the chest, maximizing the rise in the belly. We want to breathe in through our nose, fill that belly with air, and exhale. It's important that we don't just breathe into the front of our belly, but we also want to breathe laterally and posteriorly. So we want to breathe into our back, trying to breathe our back into the floor and spread that out. We're also breathing into the posterior rib cage to help open up that area as well, that can hold some residual tightness and tension as we develop suboptimal or dysfunctional breathing patterns. So again, we're going to breathe into the belly, through the nose, out the mouth. Minimize the rise in the chest, maximize that breath in the abdomen. This technique can be a very good reset for the body, especially if you are going into a posterior chain workout and let's say you get through your sets, you're having some back pain, some back discomfort. You can use this to help calm down the nervous system and calm down the erector spinae muscle group, as well as use it to start your day or end your day with some breathing mechanics that you can work into your routine to reduce the amount of breath in the upper chest and the neck, and to again reintegrate that proper stabilization of the diaphragm into the lumbopelvic canister. Thanks for watching. Check out our YouTube video for more content and the full length of this video, and follow us at Progressive Mobility, Progressive_Mobility, and Progressive Mobility_AT on Instagram. Thanks.